It is now my honor and my pleasure to introduce Dr. Ariel Kor, who's also a friend. Ariel is the founder and a major figure in the past couple of years in the field of addiction and mental health. Ariel is a co-founder of the Israeli Center for Prevention of Addictions, and he will very shortly be joining the Hebrew University in the joint center we are setting up. So, Ariel, the floor is yours.
Thank you very much. This is a real honor. I don't know whether I should say good morning, afternoon, and evening to all of you. Thank you to the Hebrew University for inviting me to speak at what looks like a very important forum. I don't know who exactly is on the Zoom, but I would like to send my deep condolences to any of you who are currently bereaving family members and friends. We're praying for the safe return of the 240 hostages that are held in Gaza, all the IDF soldiers who are putting their lives at risk so that I can sit here in my home comfortably and speak to you over Zoom, and for all the wounded Israelis recovering in hospitals and at home. So for those who don't know me, if you don't mind, I'll just very briefly introduce myself. My name is Ariel Kor. I'm a son to Israeli parents who migrated to Singapore decades ago. Following Singapore, I proceeded to study at Oxford and I had this dream of becoming a college professor. But life takes mysterious turns, and rather than a PhD, I entered a career in banking, private equity, and then the hedge fund space. I've since become what we call a reformed hedgie, and I returned to school, got a PhD in clinical psychology from Columbia, decided to become what I don't love the term, but it's called a social entrepreneur. We made Aliyah, and I established a not-for-profit in the field of addiction and mental health. Now, for many years, I think decades actually, the philanthropic community has harnessed itself towards capacity building, vis-a-vis the development of resilience and well-being, and particularly for at-risk populations. This is true for the Western world, and it's very much true for Israel. But we did much less to alleviate the suffering of mental illness in general. So why are we having this discussion now? Really for two main reasons. The first is October 7th, and I don't know how much you've spoken about October 7th on the Zoom, but the atrocities committed by Hamas on October 7th will forever be carved as a national trauma. Now, we've learned as researchers from many years of experience, from wars, from attacks, but I can safely say that the real impact of this war will manifest itself in time to come. Now, thus far, we're only starting to see what is called post-traumatic stress disorder, or PTSD, but we've had to deal in a very acute way with what is known as acute stress disorder, or ASD. Now, that's an acute stress response that appears up to a month following a traumatic event. It is a response due to lack of clarity, lack of certainty. For example, are there still terrorists walking around the street, or will the Hezbollah be attacking us in the north? Now, as we as a collective, as a nation, feel that the IDF are regaining control over the situation, the physiological stress response begins or should begin to subside, and our bodies can begin to soothe. Well, we're not really there yet. Now, the surprise attack launched by Hamas, which included the most savage of massacres our nations and people have experienced, the abduction of over 200 of our citizens, and a delayed reaction from our security services, both the police and the army, sent us all into a state of shock. Now, the reports of the scale of the atrocities, accompanied by desperate pleas for help from residents of Gaza, hiding the Gaza envelope, of course, hiding and begging for rescue, and it led to acute stress in everybody who was exposed. Now, what happened to Israelis during those days, and what can be considered a light at the end of this very dark tunnel that we've entered? Now, trauma-inducing events are those in which a person is exposed to physical or mental danger as a result of, let's say, war or accident, sexual or physical assault, or any other life-threatening event. Now, today we know that even the bare witnessing of such an event, even if a person is a complete stranger, has the same potential. Now, these events have strong components of an inability to control the situation and to forecast and plan for it. Now, this is all on the personal level. As a collective, as a nation, these events are ones which pose a threat to our set of values, to our narrative. Trauma shatters the story that a person tells himself on who you are, on how you respond to the events surrounding you. And national trauma is a fracture at best, and in our case, the shattering of an entire societal narrative, what we've been telling ourselves as a society. And what happened on Simchat Torah shatters our conception that the IDF will always come to our rescue. That if we're ever attacked, the police will show up, the IDF will show up, somebody will show up. We've been taught from day one that if you're to call the security services, they show up. Well, no one did on October 7th for many bloody and tragic hours. Trust has been collectively shattered, and that is in part what creates a national trauma. Well, then the situation got worse, because since more than 120,000 Israelis have been displaced and are refugees inside their own country, over 380,000 of our citizens have now been drafted. It's arguably the most acute crisis in the history of our nation. But, in Japanese, the word crisis has kanjis of actually two words. One is of danger and the other one is of opportunity. So where is the light? Where is the opportunity? Firstly, at the face of a very slow government response, the mobilization of Israel's civil society has been unprecedented. Really, a display of power of the human spirit. Secondly, less than 20% of people exposed to trauma will develop one of the three most prevalent responses to it, be it PTSD, addiction, or depression. Now, I've personally been working with evacuees from Kfar Aza, who are now in Shfaim, which is near Herzliya, since the afternoon of Sunday, October 8th. We've set up emergency services there 24/7, and I'll probably refrain from getting into graphic details, but it will suffice to say that in all my years as a clinical psychologist, I've never experienced anything like what we're witnessing. And I'll be happy to answer questions about this at the end. Addiction and mental health affects each and every one of us, whether directly or indirectly. And it is time we decide to engage in an open and honest conversation about it. Approximately 23% of the people in the United States, 18% in the UK, and 21% in Israel will at some point have a diagnosable addiction and mental illness in their lives. These are people like you and me. They're people we encounter every day. Those who teach our children, drive the taxis we ride in, and write the books we read. In fact, we may actually be talking about ourselves, or perhaps our family members. Now, it is crucial that we recognize addiction and mental health as an integral component of our being, just like physical health. Now, the impact of it, extends beyond the individual. It affects our families, our communities, our societies. It hampers productivity, it strains relationships, it diminishes the quality of our life. And by addressing it, we not only improve the lives of the specific individuals, but we become a much more compassionate and stronger society. But despite the universality of this issue, and even though I'm a professor for clinical psychology, I and we all struggle to talk about addiction and mental health openly, or to offer adequate care or resources. We often remain silenced by a shame that tells us that those with mental illness are somehow less worthy or at fault for their own suffering. Stigma breeds shame. Stigma breeds silence. Now, we can no longer afford to be silenced by stigma or stymied by misguided ideas that portray these conditions as a matter of weakness or moral failing. Now, although excellent medications and therapies exist, only about 20% of people with addiction and mental health difficulties will ever receive treatment. There are many reasons why people don't get care. That includes cost and lack of access to qualified providers. But the major reason people don't seek treatment, even when access and funds are available, is stigma. Now, why is this discussion just urgent, and not just because of October 7th? The answer is that our adolescent children are suffering like never before. Since 2007, there is an unprecedented increase in mental illness markers among adolescents in the Western world, particularly for depression, for anxiety, and for addiction. It is alarming. We're in the midst of a crisis. The signs are everywhere, and they're flashing red. Now, I'll just give you some examples. Israeli adolescents are spending approximately 10 hours a day on their screens. Now, the cynics in this room will argue that most of it is for learning. Well, it's not. Adolescent use of alcohol in Israel has tripled since 2019, tripled. Mental health pathology, be it substances, depression, or anxiety, has more than doubled over the past 4 years. And since October 8th, the prescriptions of benzodiazepines, which is a highly effective but also a highly addictive anxiety medication, is up 320%. This is just since October 8th. You may think these changes are Israel-specific. Well, they're not, because epidemiological data in the Western world depicts a bleaker picture elsewhere. Now, the cynics here will reemerge and argue that we're overdiagnosing or using too loose of a diagnostic criteria. Well, we probably are. But even when you control for this, meaning you clean the data for overdiagnosis, the situation is dire. Something must change, and something bold has to be done. Our nation is among the world leaders in many fields of medicine, of science, of technology. Our country's healthcare system is a source of pride and wonder, and I've lived in 7 countries in my life, so I can tell you that for sure. As was most recently demonstrated in the highly effective rollout of COVID-19 of the vaccinations, but in the area of addiction and mental health, of research, of training, of prevention, of treatment, our system is sorely lacking. Now, my relationship with the Hebrew University commenced in 2009. I was then running a fund and flirting with the idea of starting a second life, and I called Professor Ariel Kor. He was then the head of the psychology department, who was kind enough to sit down with me for over an hour, advising me as to the possible courses of action. Now, although I'm really from Singapore, I'm an 8th-generation Jerusalemite, and I've always wanted to become a part of the development and of the growth of the city. Now, the Hebrew University, and I don't know how much you appreciate it, is unique in its approach of not only being a center of academic excellence, and really of the highest order, but it is also an institution which leads the way in impacting the street. Now, the university, in collaboration with the Israel Center on Addiction, the not-for-profit that I established, is now disrupting this entrenched paradigm, and we're in the midst of building the first of its kind university-based center that will serve as a multidisciplinary research and also clinical hub to address issues of addiction and mental health in Israel. Now, the center will leverage the experience of our NGO, of the Israel Center on Addiction, in both treatment, in training, and in prevention, and will conduct wide-ranging research and academic expertise of the Hebrew University, and we will jointly establish and operate what is going to be called the Israel Center on Addiction and Mental Health. The center received a very generous grant from the Israeli Foundation, and we're very grateful to them. Now, the center is going to be bringing together an interdisciplinary team of world-class researchers, clinicians, practitioners, and hopefully will generate breakthroughs in the understanding, in the prevention, in the treatment of addiction and of mental health. Experts from a wide variety of disciplines, from neuroscience to public policy, encompassing brain and life sciences, of medicine, of public health, of psychology, of social work, pharmacology, will bring together their expertise. And this will bear the address to challenge this very big challenge that we have ahead of us, the challenge of addiction and mental health, which since October 7th has become much bigger. Through the center, our scientists, the academics, the practitioners will engage in basic and applied research. We will train the next generation of service providers, implement prevention programs, and advance public policy in addiction and mental health, and also provide patient care. A site has been extended by the university to house these operations in Mount Scopus, and it will very much power our center. Construction is actually under site, and enable the center to research, to validate, to evaluate, and to disseminate the knowledge. The renovations, which are unfortunately very expensive, have been funded by a Canadian foundation called the Roadberg Foundation, as well as the municipality of Jerusalem. We all have to remind ourselves again and again, addiction and mental health is health. Now, there is no doubt the sum of Israel's strength comes from being a startup nation, from an astonishing scientific development that our nation has produced. More recently, we've seen divided elections and divided societies. We've seen the growth of extremism in politics and religions. We've witnessed atrocities. I believe that most of it is driven by the fear and anxiety of a world that is changing faster than we can bear, and the sheer knowledge that it will change faster still. And the situation here is troubling to us all. Now, it may be more attractive to support the rebuilding of the Gaza envelope, democracy in Israel, the technology sector, wounded soldiers, and excellence in education. All are very worthy causes. But that will once again neglect the cause of addiction and mental health, which is a silent epidemic that is now becoming not so silent. Addiction currently receives less than 0.1% of global aid. It's not a mistake, less than 0.1%. Domestic financing on prevention, promotion, and treatment is similarly low. So really, at present, every nation in the world is a developing country when it comes to addiction. Such paltry investment is not just bad for individuals, it is destructive for communities and it undermines economies. Addiction in mental health costs the world $2.9 trillion a year. And this figure is expected to balloon to $7 trillion by 2030, unless we take action. Now, research shows that there is a 4 to 7-fold return on investment for every dollar spent on treating and preventing addiction, making spending on the issue a great investment for both political leaders and for employers, for funders, and in addition to generating savings in the health sector. So, I would like to sum. This is really a call to action, because to effect change, we need the power of philanthropists, of social activists, of you. Maybe you're somebody who's coping with substance addiction, or maybe you have a family member who's suffering from trauma. Maybe you're a provider looking to improve the care that you deliver, or maybe you're the CEO of a large company who cares about their employees. Maybe you're just somebody who simply wants to save lives. But no matter who you are, this is a call to action for you. I want to express my deep gratitude to all of you for being here, to the Hebrew University for enabling us to do what it is that we're doing. And I really believe that together we can change the narrative surrounding addiction and mental health and create a more compassionate society to make sure that nobody is left behind, particularly in light of the recent atrocities. Addiction and mental health has always been the stepsister of health, but has now become a critical and urgent need. Now, the faster we're able to intervene, the better outcomes we're likely to experience. The national mental health system, which is on the brink of collapse prior to the war, is now experiencing a tsunami. And really, it's incumbent upon civil society to assume this responsibility until a national, sovereign-led and sponsored solution will be established. I will conclude by quoting C.S. Lewis, who said that hardships often prepare ordinary people for an extraordinary destiny. And I believe, and I strongly believe that our people and our nation can and will return to becoming an extraordinary nation. Thank you.
Thank you, Ariel, for these words. And we all look forward to the continued collaboration of the university and the Israeli Center for Addiction and Mental Health. So a big thank you.